Hello, 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 hello. Good evening. Okay. Ebusiafo, yasa abadum. Last week na yɛdɔka yɛ busy kakra nti yɛntumi amfa time with Dr. Cheme amba. But ɛnɛ deɛ nyame adom yɛ doctor abɛka yɛn nsa. Mpuntu Farms ɛne Jokovet Company Limited ɛna ɛde dwumadie yi ɛbrɛ mu every Sunday. Ɛno ne yɛ whereby a doctor ɛwɔ time say on here biribi. So this evening I welcome all of us to Time with Dr. Cheme. This program is actually brought to you by Impuntu Farms and Jokovet Company Limited. Yesterday, we couldn't, I said yesterday, sorry, last week, we couldn't bring you this program. We couldn't air the program online. Yes, because our doctor was unavailable. He was busy at another important meeting. So we couldn't bring this thing to you. But today we are here and we are with Dr. Cheme. We are discussing fowl pox. Fowl pox. And fowl pox, as we know, uh, it has become a thorn in most of the farmers' flesh. Most of us, some are experiencing the severe parts, and some are also experiencing the mild parts of fowl pox. So this evening we'll be talking about fowl pox. Nyame yɛ adom a yɛbɛka fowl pox ho asɛm ɛna anyway. Na fowl pox no ɛha farmers bebree, ɛha farmers bebree. Ɛna afei so ɛma farmers tó nduro bɔka ne adeɛ, but ebia sɛnea yɛaba ha no doctor bɛkyerɛ yɛn nneɛma a ɛwɔ sɛ yɛtumi yɛ na ɛma fowl pox no ano brɛ ase anaasɛ sɛ wo mmoa no koraa wɔanya ebetumi ama yareɛ no ayɛ dɛ aba fam ama mmoa no na ntumi ndi mmoa no so. Ɛno nti na nyame adom yɛabɛpie mu wɔ ha. Nti yɛ doc ɛwɔ ahoma no so ɔwɔ line no so nti ɛnkyɛ biara no yɛbɛma doc aba na waba abɛstarte dwumadie no. Okay. Sɛnea mekae no abusuafoɔ, saa program wei ɛyɛ Impuntu Farms ɛne Jokovet na ɛde brɛ mo. Sɛ wopɛ Impuntu Farms yɛakyi akwan a yɛwɔ Taifa na yɛtenabea ne baabi a yɛwɔ no, sɛ wopɛ poultry ho nneɛma papapaa efiri nduro ɛde kɔ equipment, ɛde kɔ feed, ɛde kɔ biribi biara wobɛhia ɛwɔ wo poultry farm biara ɛne hwehwɛ akyi akwan. Yɛwɔ Taifa, yɛwɔ Accra. Na sɛ Jokovet so wopɛ wɔn akyi akwan a wɔn nso wɔwɔ Accra saa nso wɔ Kuntunse bus stop hɔ na wobɛhu Jokovet company. Jokovet so wɔ equipment ɛne nnuro. Yɛn nnuro ɛfa na yɛgye ɛwɔ Jokovet for wɔn ankasa na ɛde ba na wɔn nnuro yɛ good, especially deɛ ɛbɛma wo mmoa ato nkosua bebree. Ɛyɛ very good. Nti ɛna anwummere this evening we are talking about fowl pox. Fowl pox. Our doctor is online and we will kickstart the whole program. So without wasting much time, I'll give the floor to Doc. Doc.
Hello, Dacosta.
Doc. Good evening. No.
Evening. I'm still setting up, maybe.
Okay. Okay. Okay.
Is it okay now?
Yeah, it's okay. It's okay. Fowl pox disease. The treatment, control, and prevention. We can clearly see it on our screens, and we are live on YouTube. We are live on Facebook. Ubuntu Farms page. Nti sɛ share a mepakyɛw share why share na obi so enya please share for other farmers to also join us so kindly share okay thank you doc ebetumi ato aso.
All right. Good evening, everyone. You're welcome
Good
to
evening.
another session of Time with Dr. Boache. Today, we continue our viral disease session, and the topic is fowl pox. We've already treated Newcastle, we've treated Bumburu, and then yes. So today we are doing fowl pox. Fowl is viral infection. Yeah, when most used to your medication vaccination chart, and you realize that there's fowl pox also. I do usually around 8 to 10 weeks and then 12 weeks. So today we are going to discuss the disease itself, how the disease, how the disease is treated, treatment protocols that are available, some control and then prevention measures, and then we talk about a few general recommendations. So same here we did for Newcastle, Gumboro, we do the same thing over here. So fowl pox is a viral disease. Today's session is going to be quite short because this one is not quite.
Anuanom ne adɔfo asɛ doc efi ahoma no so kakraa ne network ne nhyɛ daa ɛnyɛ mpamkyɛw mesa so ajoin ne back na waba abɛtoa deɛ na ɔyɛ so nti sɛnea mekae no dwumadie Ubuntu Farms ɛna ɛde saa dwumadie brɛ wo. Nti te sɛ the doc ɛreba back sɛ wopɛ akyi akwan a yɛwɔ Taifa Burkina Accra. Okay, nti doc asa aba ahoma no so. Doc asa
Hello,
aba.
can you hear me?
Yeah, doc. Now as online no but since I say I fine.
Okay, so let me start again.
Okay, sir. Okay, sir.
All right, so sorry guys, I'm having small challenges with my network. So as I said, today we are discussing fowl pox. We're going to talk about the disease, how it is transmitted, how we can identify the disease on our farms, how we can treat, how to control, and then how to prevent the disease. Just as we discussed for the various viral disease that we already treated. So this is the outline of the today's presentation. Fowl pox, as we all know, maybe some of you might not know, but fowl pox is a viral disease that affects poultry. And just as we all know, fowl pox presents itself as wat-like lesions. Those are some of the classical signs of fowl pox that we know. Okay. but it goes beyond that. But the one we all know at your level, as let's say farmers know, with the muhu the ACC na you call that fowl pox, and then it's true. However, there's another form. It's not usually common, but it's also present in poultry birds, and that one is the diphtheric form. Now, that one usually appears in the throat, inside the beak. So any part now when you so along the respiratory tract and then digestive tract, that's where you see it. Usually it's na say yeah postmortem. You check it on now, you be so maybe a fowl pox, but you might not see the lesions on the beak and then the face now okay. And then fowl pox, unlike the Newcastle and then Gumboro now we treated, fowl pox is a bit slow spreading. Newcastle and then Gumboro discuss here and realize that that one is very contagious and it spreads quite quickly. But fowl pox is the opposite. That one is quite slow. And then the cutaneous form, and then the popular one now we all know, the who pox that one is a bit mild. But the diphtheric form, it can result in mortalities. But usually, the resulting in pox, you don't usually see the birds dying from that. Fowl pox is usually spread through open wounds. Into a sɛ mite wɔ mo ho, lice wɔ mo ho, na sɛ ɛsosɔ mmoa no titi wɔn ho a, na sɛ ekuro ba body no ho a, the virus can enter those places and then the lesion might begin to occur. Okay, and then it has economic importance because your fans say who was spent layers you want to sell them. But obi ba na sɛ pox ɛwɔ mo ho, ɔbɛka sɛ oh mmoa no mo yare nti ɔntɔ. And I say price or no pen or the amount, and then the farmer will end up losing a lot of money. Okay, so it has economic importance, and then also because sometimes, usually in the diphtheric form, the animals are not able to eat, they lose weight, and then this will result in drop in egg production. Okay, so once your birds are not producing well for you, you'll be losing money, and then you'll be wasting money in the feed that they are consuming because they will consume and then they will not be able to translate those consumptions into egg production for you. And then since some of the birds are not able to eat, especially in the young birds, can result in mortality because I thought that the diphtheric form that make I don't know. Lesions is see on the minimum baby on home fan. So once the animal is struggling to breathe and then to eat, usually it will result in mortalities. So you should be very careful. Usually we only see the cutaneous one, but there is the diphtheric form that usually you don't see. How is the disease transmitted? So now we know that fowl pox is a viral infection. It spreads slowly. But now you have to see how the disease is transmitted on your farm. And then these are some of the ways that they are transmitted on the farm. Direct contact. So, aboa bi wɔ pox no wɔ ne ho na sɛ ɔkɔbɛn aboa foforɔ a wɔn bi ba yɛ bi a ekuro wɔ ne ho a, the virus can easily enter through the wound na ɛwɔ healthy animal ne ho no, and then it can enter and then cause infection in that animal. And then we have the indirect contact, and also usually through formites. We discussed formites in our previous session. Formites are all inanimate objects on the farm that can hold or harbor pathogens or disease-causing organisms. So your feeders, your drinkers, anything on the farm there other than the birds themselves, can be a formite. And then also insects or pests or any animal on the farm over there, because the mosquitoes also someone, and then we have mice or lice, anything be a cause a wound on the animal, it is a mosquito or insect also, or the animals have mites on them, they have lice on them. Once they keep on biting the animal, they open wounds on the animal, And hence, if the virus is on your farmer, they can easily lodge inside the wound and then begin to cause infection. So, three main ways: direct contact. Nti yɛmfa sɛ aboa baako ɛwɔ na ɔbɛn aboa foforɔ a ebi a wepra wɔ ne ho a the virus can enter through the wound. No? So these ones usually they need a wound or an opening in the skin for them to cause infection. And this other ones now, some of them were through the nose. Once the animal is breathing, and then another animal even picks up the virus from air now, it can cause infection. This one it has to be direct, so usually through an open wound. Yes, so that's how the disease is transmitted. We have the direct contact, indirect contact, and then through insects. So we say mosquitoes, baby, we say mites, or lice, or one. Once they keep on biting your bears, they will cause wounds on the bears. The infection can spread. Next, we are going to talk about how do we identify the disease on the farm. How do we identify the disease? The common one that we all know is the ones now farmer no obehu lesions and now pox na ɛwɔ mmoa no ho no. The farmer no ohu pox. So the technical term is wart-like lesions. But I don't know friend pox. So pox na mo hu wɔ n'ano no ho, n'ani ho, n'anim ho, ne kɔn ho. Ɛtɔ da kora even the wings na se no. You can even see them there. That's the main one, the common one that we all know. However, there's a next form. It's not usually common, but it causes a lot of damage. And we are diphtheric form. No? Now you usually see white or yellow plaques or swellings inside the throat, the mouth, nasal passages, and then the trachea. No? Okay. In the next slide, I'll show you a picture of how that one presents. So these two are the two main ways. We have the cutaneous form. That one is the common one now, will be who pox minimum. And then there's the second form, which is the diphtheric form now. That one usually occurs in the parts now you don't see with your eyes. I see if you watch a day be a one man sana who usually say who the PM back lab honoma. You might not see it on the face, but PM near be a one more, then we see these ones. And then also we have eye swelling, both a abuanemia swa. If you are not careful, you might think say coryza. Because in coryza, the common sign is the eye swelling. So that is why it's always important to always consult with your vet. Because I wouldn't say coryza now could be for the treatment might not help. Okay. And then there's crusting. Bones has a skin no eye ding ABLYY. And then there's discharges. As in and then difficulty in breathing. So as I said, diphtheric form, no, you get swellings along the nasal passages and then the trachea na. Bones a blocky baby anka abuane home fano. And hence the animal will be showing signs of even CRD. So if you are not careful, you think a CRD, no akoto, tylosin, drugs in Ningina moment, you'll be like the drug is not working. But ABI is because you misdiagnosed infection, now you are treating it for something else that is not. Then since the animals are not eating, they are not drinking, it will result in weight loss. So that's another sign. Because ODD or breeding tea, they have decreased appetite. And then once the animals are not eating, they are not drinking, in the laying birds, it will result in drop in egg production. So if it is the diphtheric form now, you might not see the what-like lesions now in. But I say, if you are swati, omu didi but omu nsheda anya kesiye. Omu homea is a bit difficult, and then there will be discharges from the mouth and then the nasal cavity. No? Okay. So this is a picture of the two forms in American. So the first one is the common one that we all know. I wish I had one name now. As a pimples, pox B, Nenima Swabisa, no, that's the classical one that we all know. But in the second picture, no, Abuano ye be any minimum. And you can see say arrows be air pointing honum. See those arrows no na the diphtheric form of or lesion na. And on to when bones Abuano outside body need the what like lesions ni ho pox ni ho. But owu ye ne ye buy ni mu no. Bones say noodles we no. E won a minimum baby odidi fa no. Baby or home fan, you'll be seeing these lesions there. And then this can block baby and framane fano, baby aduane fano, and hence say blocking baby and framane fana. It will result in signs like CRD because I want to me or break. And then this one because aduane baby tree, Sanyama we never any anti. Obey I say the animal might not eat because it becomes a bit difficult and then painful for the animal once they are eating. Okay, so these are the two main forms. We have the cutaneous form and then the diphtheric form. The cutaneous one is the normal one that we all know. You see the pox lesions on the face. But the diphtheric form is the one that you usually don't see. Because until Sawapaya Buanimuno, you might not see it. And it usually presents as these nodules, these lesions now you can see in the picture. No? And that's what the arrow is pointing at. And I also added that in other cases, there will be eye swelling, there will be swelling of the eye, there will be crusting, there will be discharges from the nose and then the mouth, and then there will be difficulty in breathing, weight loss. So all these are signs that you can use in identifying the infection. Now talking about treatment, I've told you time and time again, say we don't treat viruses. It's almost like cancer. You see that cancer, you don't usually treat it. You do, let's say, chemotherapy and then all the other forms of treatment, but you don't treat it directly. Say ukoyi cancer nephew, but we only manage the infection. It's the same with this one too. You don't treat viral infections, no, but you can give supportive care. Okay. And then with supportive care, no, we are talking about things like you cleaning someone and those one. And maybe I'll bet me about then you clean the site or maybe a lesions no one with iodine or even saline water, salt solution. Okay, this helps to bring it down slightly. But no but you are trying to manage the infection in the animal so that it doesn't spread easily to other animals. Okay, yes, and then early intervention. Immediately say signs of infection, try and get, let's say, iodine or salt solution just to clean and then wipe the area, and this helps to reduce the chances of secondary bacterial infection because it's an open wound. See virus in we are and no immune system na bafem, and then once the immune system has come down, other pathogens can also come in and then cause infection in the animal. Say virus no kura secondary bacterial infection na ebe mu no will be the one to even kill the animal, and the animal might not die directly from fowl pox. No. Okay, so please, you don't treat viral infections. Once again, you only support it and then provide management care, supportive care, but you can't treat viruses. And to say bacterial infection, as a bacterial infection, I can give them antibiotics. No. So there is no specific treatment for the virus, but we can prevent and then control it. And then we've discussed time and time again, say the main way to prevent most infections, especially viral infections, is through biosecurity. Okay, so you realize that right from the first session that we started with, biosecurity has been constant through it all. Every disease be a treaty so far be a say as part of the prevention and control measures, biosecurity was present. So please don't joke with biosecurity. One of the first things we discussed was biosecurity. Probably most of you guys were not around at that time, so maybe going forward, we might come back to the topic of biosecurity, and then I'll take you through how to ensure proper biosecurity on your farms. Okay, so by way of preventing or controlling the infection, one is through vaccination. So you realize that on your chart, depending on where you get your bells from, we can have some at the first fowl pox, some at I think 8 weeks, 10 weeks, and then around 12 weeks, depending on where you get your bells from or where your chart is from. So please ensure to go by your chart. Always use the chart of baby awunya or bells. No, that's one. And then secondly, if they don't have, you can use the one provided by the Veterinary Services Directorate. There is a nationally approved vaccination charter. You can go by that. However, you should always go by what your supplier is giving you. Say no ni hon then you follow the VSD vaccination chart. So with this vaccination, and to say the difference you no, it is done in the wing web method no. It is a ubie abuano ne feathers na ne nsa bones above joints no baby bones no one. There's a small flap of flesh a ɛwɔ. So that's why you are supposed to prick with injector now we use the fowl pox prick and I say syringe that's where you are supposed to prick. Okay, and to say we now your difference HB1 Lasota Gumburu na difference this one you go through that flap of skin now and what just above the bones so will be above the wings nima. Okay, and it is always important to ensure say you are maintaining the cold chain. Nti wohyɛ ase wonya mix yɛ na wohwɛ na sa womoa no dɔɔso a don't bring all the vaccines say bi asa wotɔ about let's say two womoa no around 2,000 so you bought 2 of the 1,000 doses now. Until you started the second one, don't bring it out yet. Just leave it there and that's one fridge and I say still maintain it in the ice. Nti air sanaka bear 100 to 50 bears and then you can mix it and then you begin to work with that one. Obi one man why ABR 5,000 now. One mixing in on meanwhile, me nipa bear 1 and 2 pen more. By the time I'm maybe 8,000, 2,000, not already the man makes out one the dano is beginning to lose its potency. So please ensure say until you are ready to use it, don't take it out of the fridge or out of the ice pack. No. Ensure to maintain the vaccine coaching as much as possible. Else you might think say why, but in the long run you might have just stressed the animal without giving them any actual vaccine. So that has to do with the vaccination. And the next is the biosecurity. Now we are always talking about biosecurity. Ensure proper hygiene on your place because the virus is around. Okay, it's endemic in Ghana here. See, any has yanka, yeah, when fan shit vaccination charts and so. And then realize that it is constant in all the vaccination charts from all the various suppliers. Supplier be the most fowl pox issue because once you joke, you might get the infection on your farm. And then as we discussed in the introduction, they say but it has economic importance. Omadane spent layers now person. Once someone sees the birds with these what-like lesions on them, they might not buy because they'll say that the birds are not healthy, they are sick. But meanwhile, they might have recovered from it, even though they are carriers, but they might have recovered from the infection. And then the person might not agree to give you the full price of an you want to sell the animals, no, the birds. No. And then once the diphtheric form is also in there, the animals might not eat, they might not drink, and this will translate into poor egg production, and then loss of weight. And then it will not be good for you, especially in areas where broilers are. But even broilers, usually they don't even get to the point where you have to do the fowl pox. No? But those who keep them for a long time, no? Once you are crossing the 8-10 weeks, you might have to do the fowl pox vaccination for them. And then once they get the infection, once someone comes to buy it and he sees these lesions on them, we are the on top. Okay. And then next one is early detection. So immediately you see 1-2 of the birds showing signs of this infection. Now you can once a year. Immediately, don't think twice about it. Just separate the birds and then consult your vet. Some way, somehow, the good thing about it is it doesn't really spread fast. It doesn't really spread fast. And to say Newcastle now, and as a gumbo and communia, yeah, then over a short period of time, no, almost all the birds will come down with the infection. But that's why it doesn't spread fast. So immediately, infection, try and separate the birds that are affected, no, and then you consult your vet. He'll tell you how to go about the treatment or more treatment plan on how to finish or take care of the birds. So in general, we've talked about how to identify the disease, the treatment, and then how to control and prevent it. And I'm repeating it again. You can't treat viral infection. The best you can do is to provide supportive care. Okay. Yes. So, and then with regards to biosecurity and then vaccination, those are the two main ways that we prevent and then control the infection. So as I said, today's one is going to be quite short. So with regards to the general recommendations, just as we did for the previous slides, or the previous discussions, ensure proper disinfection before, during, and then after. Once you have birds coming in, ensure to disinfect your place, especially if you've used that farm before to rear, let's say, birds before, because they might not have come down with the infection. I'm aware, but they were carriers that they shed it into the environment. And then as time goes on, these viruses and then pathogens are able to mutate, to change their form. Okay, so the longer they stay on your end without you doing the necessary treatment or prevention or biosecurity measures, now the viruses or the pathogens might mutate, and then in your subsequent batches of birds, they might easily come down with the infection. So you have to be very careful about some of these things, especially disinfection. So you do it before the birds arrive. When they are there regularly, you can be disinfecting your place. And immediately you are done with the phase of birds. Once you sell the birds, don't wait till the next batch of birds are coming before you clear the place and then set up the place. No. Immediately you are done with a rearing phase. At most, the following day now, go and clear the litter from there and then start disinfecting the place. Because the longer the litter stays there, the easier the pathogens are able to mutate and then change their form. Okay. And then comply to the appropriate vaccination schedule. So we have the one from VSD, the nationally accepted vaccination schedule, and then comply to the ones that your supplier is giving you. So you go to Input 2 Farms, he'll give you a very nice vaccination scheduler. Everything you have to do right from day old to about 16 weeks is stipulated on it. Onumponi then was in color coding, so depending on what you are doing, the color don't grab it to actually say this one is different, this one is different, this one is different. So please try and go by the appropriate vaccination schedule. And it is very important. So baby I'll do best from 8 weeks. Please do it 8 weeks. And found say another chat said say do it at 9 or 10 weeks. No. So far chat no say instead of doing the two vaccination first and second, no say you one pair. Do that because they know their best. They know some of the things that they've done with their best. That's how come they are telling you, say, based on what you've done, you should do this. Okay. However, so when you know, then you go by what VSD or the Veterinary Services Directorate is giving you, and then maintain cold chain of the vaccine. Please maintain the cold chain of the vaccine. It is very important because once the cold chain is broken, the potency of the vaccine is lost. So you might think say you are giving them a vaccine. However, once the potency is lost, it will not work. You end up just stressing the animals for that period. Now you drink away a vaccine, and it will not result in them achieving the required therapeutic effect. And then the worst case, they say no. They say you go about saying say, oh, you did it, and then it was the vaccine that you used. The vaccine that you used wasn't good, and maybe I will turn on na. However, we didn't do your part well, and then maintain the vaccine cold chain, especially those who are more mukoto there. Ya make say no more mukoto there mixing at least who at least 500, 800 beds. Who the fakato a casona just buy the full one. Okay, you might say oh, that 100 cities 200 difference 200 cities no difference no is too much. However, even if you should lose just two animals, or let's say even one from fowl pox here, on the market you sell spent layers between 7 to around 120 cities. Ti we lose back on waboka extra 20 cities because anka I kind of also say oh difference in 100 cities no. Awabaku from infection now you are trying to avoid now. Waboka. Let's not even talk about Kosiana and Kasabu and Obeto amount, no. But just the animal alone dying, no. Waboka. Okay. So try as much as possible, especially more motor the Amex said that no, especially 500 birds and above. You try and buy the full dose. It's relatively better and cheaper as compared to say, oh, you want to buy just your birds are just 200 into you are just buying just 200. Okay. And then next one is proper carcass disposal and then litter management. I've always been saying it right from the first session. Always dispose of your carcass and then litter properly because these are the main areas our pathogens may be harboring. So if you are not careful, the pathogens will continue to proliferate and then multiply if you don't take care of your carcass and then your litter properly. So please and please properly dispose of your carcass and then your litter, else the pathogens will continue to multiply on your farm. And then finally, you buy from trusted sources. So as a way of summary, we've discussed today that fowl is a viral infection. It presents in two main ways: the cutaneous form and then the diphtheric form. The cutaneous form is the most popular one and the common one now we all know. That's the pox or the wat-like lesions now we see on the beaks, the face, the neck, and the comb and wattles of the animals. And then today we've learned that there's another form that we the farmers usually don't see, but it's also there. This is the diphtheric form. And in this one, you will get noodles or swellings or white or yellowish lesions inside the respiratory tract or the beak, inside the mouth. Bones no. As a pox ni be na esisi no. You might not see it on the face, but you see it inside the nasal cavity. And then this usually results in difficulty in breathing, difficulty in eating. And then we've also discussed that you can also get swelling of the eyes, and then if you are not careful, you might think say a coryza, but meanwhile it would be fowl pox instead. And then I've stated that it also has economic importance because once there are lesions like that on the face, you lose the market price of the bird when you are ready to sell them as spent layers. And then also, since the animals are not able to eat because of the diphtheric form, it will result in poor egg production and then loss of weight. The growth rate will be decreased. So it results in economic losses. So we should be careful about that. And then in worst case scenario, in young birds, since they're not able to eat, they will die. With regards to disease transmission, the disease is transmitted through direct contact, indirect contact, and then sometimes insects. The direct contact, when there are wounds on the body, on the skin, the virus easily enters, and then proliferation and then infection might occur. The indirect is through fomites or contaminated surfaces, feathers, equipment, anything you use on the farm. And then once you have insects, mites, lice on the farm, these insects chew or bite the birds, and this results in wounds on the skin that are easily infected with the virus and then result in infection. In the picture then, as you can see, there's the cutaneous form, there's the diphtheric form. Diphtheric form is inside, so you might not see, but usually what the back that's a yeah PMR, we will see it and then you catch us maybe a foul pox. But because you didn't know, say foul pox can present like this, because oh doctor no cry, me call no, or same one in your foul pox, but one will be NCC or many. We mean your foul pox because they have the diphtheric form. Until any doctor no about no, you won't win him. Okay, into corner say you didn't see the lesions, but doctor catch us say, or mean your foul pox, it could be say he saw the diphtheric form. And then you didn't see it on the face, into don't doubt the doctor said, doctor name the ultra. Okay, yeah. Anyway, regards to treatment, I've told you time and time again, say you don't treat viruses. No, the best you can do is to ensure your biosecurity, provide some supportive care on your farm, and then you comply to the vaccination schedule. And about baby, your weapon, to be wings now. There's a small flap above the bone where the joint is. No, that's where you do the fowl pox vaccination. Okay, so I'll end the presentation here. If there are any questions, I think Da Costa will moderate for me, and then if there are any questions, you can let me know. All right, thank you.
Okay, Doc, thank you very much. Yeah, so there are some questions that they've posted on the Facebook and also the YouTube links. So I would want to show it. I don't know if you can see it, but let me also read it out. It says, so Doc, how can someone control insect population in the pen and the compound also? Because you made mention of mosquitoes and mites that normally bring about this chewing and the virus taking advantage of it.
All right, so thank you. So with regards to insect, you can use the most common brands that we have on the market. You can even use cypermethrin, the acaricide that you know, amitraz, desban. You can mix it in the knapsack sprayer, and then you can spray around the farm. Okay, around the farm you can use these acaricides and then the desban or the index fly. These are common brands on the market that no flies. You can all use some of these things. So you spray around the farm and then inside the farm. So that is if your area is highly infected with the insects. So you can spray on a regular basis in and around the farm.
Okay, but would that have any effect on the birds?
So usually with a very strong um, products, it can result in some form of respiratory distress in the animal. So you can try and tone down the dosage. So usually you see
O-
that, especially on cypermethrin like this, they'll write spraying on the compound. It has a different dosage, and then when you are spraying on the animals too, there's a different dosage. So you don't use the same dosage for the two of them. So usually the one that you are spraying where the animals are, the dosage is a bit diluted. You don't use the same dosage inside, because if you use the same thing, the animals might not be able to um, accommodate the smell in there, and then it will cause more
o-
harm than good. Okay.
Okay. Okay. Okay. And another question is also someone is asking, how do you deworm children? But with this one, we just have to get the dewormer and deworm them, put, put it in water. But even that's not what we are discussing today. Today we are discussing about fowl pox. So normally the questions that are asked should be on the topic that is being discussed. Okay, so if you want to ask any question, yeah, kindly. And someone is also asking another question. Says, what symptoms will fowl exhibit when disease is diphtheria? Think the diphtheric form that we were talking about. He said, I recall you said there's no clear visuals on the bed. So what can I use to know?
Exactly. So I stated also that because usually the diphtheric form affects the nasal passages, the animal will have difficulty in breathing. Okay. Once the
Okay.
animal has difficulty in breathing, they'll be making those respiratory signs, or they'll be giving you those respiratory signs, and you might mistaking them as CRD. Okay, that's why I added that. Always consult your vet, so that say he will do PM, and then he'll be able to tell you, say, this is CRD or not, this is Newcastle or not. Because I think in one of the previous presentations, someone asked about a question about his animals having CRD, and then he did all the treatment that he knows. He gave them all the drugs, and still it didn't go. And he said, if the disease is, let's say, fowl pox, them present those respiratory distress signs now, you do all your bacteria treatment, but it won't go. And then we've also discussed previously that Newcastle too will present as this respiratory distress. So if you don't consult your vet now, even from now, from the time we started, you know at least three diseases are that can all show signs of respiratory distress. Okay. And then today too, you are seeing that this one too also shows that, because the diphtheric form, the swelling occurs inside the nasal cavity, inside the mouth, and then there's difficulty in breathing because it's in the passageway. The animal might not eat well, and then once the animal is not eating well, the growth will be standard. You see, the growth will not pick up because aban only there will be stunted growth there, and then the animal will lose weight. And then if they are laying birds, there will be drop in egg production. Okay. So once you don't see these two classical signs now, you look out for the others. However, it's not in your place to begin treatment. Consult your vet. Say he will do a postmortem, and he will be able to finally tell you, say, okay, this is it. Okay. So all the say who signs they say they are not eating well, the animals are having difficulty breathing, your your production has gone down, and then maybe you are not seeing the white-like lesions on your face now. Whenever you get a mortality, immediately send it to VSD or the closest laboratory to you, so that they can do a postmortem for you, and then they'll be able to tell you exactly what the problem is. Okay. So this one you might not see the diphtheric form, you will not see, but once you see the other signs, immediately consult your vet.
Okay, so someone is also asking, can I do the fowl pox vaccine at 8 week and repeat it at 12 week.
Okay, so that's a very good question. And then that one comes back to what I said earlier. I said always comply to the vaccination chart. Okay, if your vaccination chart tells you do it at 8 weeks, that's when you are supposed to do it. However, should in case the animals come down with the infection, the infant said in one around 6 weeks, you begin to see signs of the infection now. You might have to do it earlier than what is on the chart. However, it is your vet that will tell you, say, okay, we have to do it earlier. Then he will tell you the time when to do it. So you realize that all the vaccinations they are spaced out. They are spaced out so that whatever you are doing doesn't go and counter what something else that you are doing. To once you consult your vet will say, okay, since then now they are showing the signs of the infection, you have to do it earlier, and hence this is the best time for you to do it. But while the opener say, yeah, 4 weeks now, but we are Ogumboro or your second Newcastle year na you might end up stressing the animals, and then some of the animals might die might die from the excessive stress of vaccination. Okay, so you consult your vet, and then he will tell you how to go about it. However, yes, it can be done earlier than the set date, only on the condition that the animals come down with the infection, and hence, as a way of counteracting the infection, you have to do the vaccination.
Okay. So someone is asking, should if we can if we can share the national approved vaccination schedule, but maybe in the next meeting we will share that kind of information here. So I think the questions so far the questions are I think we've exhausted the questions. So Doc,
Yes, sir.
thank you very much for coming to teach us this evening.
Sure.
And
You're welcome. You're welcome.
yeah, we pray that anytime we also call on you, you will help us with all of these teachings. So thank you. Don't waste much of your time. Just about okay, Doc. There's this last question. Let's talk about it. It says once the viral disease or infection is confirmed, what form of medication can one use to support the pest or treat the symptoms?
Okay, so usually you can give them an antibiotic vitamin. Okay, when it comes to in the very young birds, you can use, let's say, pen strip in the very young birds, but in the older birds, you can use drugs like tetracolivate, oxivate, which one again? Doxyfort. Some of the drugs that have that can help support the signs that the animals might be showing, because we said we have to do supportive treatment. So based on the signs that they are showing, if the animals are showing respiratory distress signs, you have to give something that will help alleviate the pain with regards to the respiratory distress. So all the drugs that you see like that, all of them have preferred site or areas of action. Okay, so drugs like tylosin like this or aerofloxacin are very good for the respiratory tract and then the gastrointestinal tract. So realize that whenever there's an gastrointestinal infection, the drug of choice is usually like enrofloxacin. When it's respiratory, you have drugs like tylosin and then doxycycline. Okay, so in this case, when they are showing the diphtheric form, to be better for you to use the drugs that have something like tylosin in it. Okay, Then the cutaneous form can use pen strip or tetraqualivate in that instance. Okay.
Okay. Okay. Last question. No, this one they beg. Last question. It says, please, will your fowl pox vaccine be effective on your birds when you delay for a week?
What do you mean by you delay for a week? Let's
Yeah,
say you are
I
supposed to
was
do
also
it this week and then you
yeah,
did it the following week, or you
I
mixed your
think so.
vaccine and then you applied it the following week.
Savior, if you can come again clearly, but I think that's what was written, and he says, but Doc, I think he wants to know with regards to the timing, whether 6 weeks or 8 weeks or 9 weeks.
Okay, okay, sure, sure, sure. So it's not a problem at all. Okay, it's not a problem, but usually don't do it before. But if
Okay,
as a result of, let's say, when you went there, the vaccine wasn't available, or you didn't get the vet to come and do the injection for you, a week is not bad. But you consult your vet; he will let you know that okay, this is the best time to do it, or wait till, let's say, the following week or something like that. Okay, because even when the animals are sick, let's say this week you are supposed to do your fowl pox infection, a fowl pox vaccination, and then your animals come down with an infection. You are not supposed to do the vaccination anymore. No, you have to take care of the birds since they are down with an infection. You have to do treatment once they recover before you go and do the vaccination. So there are instances where the vaccination you are allowed to delay it to some extent. Okay, but when the animals are sick, for instance, you are not supposed to do vaccination. You have to let the animals recover before you do it. And in such an instance, the vaccination date will be delayed. You
okay,
might be forced to do it, let's say, the following week or 2 weeks from then. Okay. So it's
okay,
not an issue if it is delayed for reasons like this.
okay, okay, okay. Doc, thank you. So as I said earlier, this program normally we do it weekly, but sometimes if doctor is unavailable, it may extend to 2 weeks or depending on when he's available. Yes. So the name of the program is Time with Dr. Chairman. And we plead that whenever you join, you share for other farmers or other groups to also have the chance to join. See, someone wrote this, and I think it's very, very true. It says, "Thank you so much. Knowledge is expensive. I'm grateful for obtaining free from Ubuntu Farms." You see, so the kind of knowledge that we are sharing, we are doing this to help farmers, and doctor is taking this pain, see, to be online most of the time on Sundays that he's supposed to rest. So do well to share to other people so that they can also have that kind of benefit. Today, we were joined by a lot of people, but sometimes we have to also push it so that other people too can join and have the same benefit that we are getting. So, Doc, thank you, and we hope to see you sometime next week or any other week. But uh, are we through with the viral infections?
Um, I'll do one more avian influenza, then we move to bacterial infections.
Okay, okay, okay. So if we will be able to do it next week, Doc will inform us. So if you're on our platforms, you'll get the information. But if you're on, or if you're not on it, to let us know, and you can WhatsApp me on 0249 26, 1 for 6 months, and we will add you to. Dog, someone says, God bless you.
Oh, God bless you too, amen. Thank you.
Yeah. So we are looking at doing it next week. But if it doesn't happen, the following week too, sometimes we will do it. Okay. So I think we'll end our live stream here and we'll go and rest for the week coming. Dog, thank you. God bless you.
Right. Thank you. Yeah. Have a nice evening.
You too, sir. Bye.